ये तो बोल रहा है रिकॉर्डिंग
नहीं सही है तो वो रिकॉर्ड कर लेना ये ऐड नहीं किया है
Good afternoon, President sir, Secretary sir, Vice President sir, everyone.
Hello, good afternoon, Dr. Kharbanda. Good afternoon, everybody.
Good afternoon. Good afternoon.
Ma'am.
Namaskar.
Very good afternoon, everybody.
Yes, sir. Yes, sir.
Very good afternoon, sir.
Good afternoon, Dr. Behra and everyone.
Good afternoon. Very good afternoon.
मेरा ना फुल स्क्रीन नहीं आ रहा उसमें आधा स्क्रीन में मेरा फोटो आ रहा है इसको फुल कैसे करें
So very good afternoon, everybody, and I welcome you all. We have just we decided we should have some chat with you and a meeting. We have.
बेहरा साहब थोड़ा माइक के नजदीक बोलिए.
आवाज कम आ रही है अभी ठीक है?
हाँ कम आ रही है.
अभी ठीक है?
आप कुछ ठीक है. स्पीक इन माइक प्लीज.
मेरे को ये कलर वाला है क्या रवि?
ठीक है पतला आ रहा चलेगा
टॉप में देखना है व्यू ऑप्शन होगा एक से
नहीं आ रहा है इस पे व्यू करके 3 डॉट आ रहे हैं उसमें आएगा
फिर क्लिक करेंगे व्यू करके ऑप्शन होगा उसमें तो
फुल स्क्रीन स्प्लिट व्यू स्लाइड ओवर स्क्रीन करके कुछ
So now I think am I clear now? My voice is clear?
Yes, it's okay.
Little better, yeah.
Very good afternoon to all of you, respected conveners and the emeritus professors. We had the last meeting we had on March 25, and this was.
सर आवाज कम आ रही है सर.
आवाज कम आ रही है.
आवाज कम क्यों आ रही है? क्या बात है आवाज क्यों?
Excuse me, may I suggest that all of us switch off our audios, please, excepting when we are talking. That would help. Please, all of us switch off our audio.
So I think now it should be okay.
Yes, it's okay now.
I think there are some technical issue here possibly. So we had this meeting last year, as I told you. Then we had met and we had requested you to encourage the various faculty members and medical professionals to join the NAMS family and apply for NAMS fellowships, associate fellowships, memberships, etc. And also we are told about the new NAMS biostatistical helpline. And then some suggestions were made to promote the NAMS academic activities, like NAMS should hold physical meetings with state conveners at least once in a year, but we'll come to that a little later. And then although we had approved in principle, but there are certain issues, so we'll discuss that subsequently. And then the updating the list of NAMS fellows and members. So that has already been done and it is an ongoing process. And then to promote the CME in medical institutions. So that we are actually writing letters to the State Directorate of Medical Education. Also, we are doing that. And then the NAMS, that letter we are actually circulating. And also about, we had informed you about the 12 weeks online certificate course on artificial intelligence in health. And then the ICMR NAMS biostatistics helpline, as I had told you, for the postgraduates. And the NAMS office has shared these details with all state conveners. and medical college cells. So these are the minutes that we had discussed last time. Then of course, I don't think we had got a meeting with the emeritus professors earlier also. We had never had a meeting earlier. At least I had not had the meeting. We have got total now 52 emeritus professors. Actually, that the total we have got 53. And we'll also listen from them what exactly we should do and how we should activate them. So basically we are having this meeting to review and seek suggestions for improvement of the NAMS academic activities. So I have already briefly told, and I think you all know, you are all senior persons associated with NAMS for many years. So you know all the activities, what we do apart from our CME activities, and then the fellowships, associate fellowships, etc. And then I have just named some of the things. I think about the CME activities, the Professor Kapil, I think now we have increased it to 2.5.
2.5.
That will be implemented.
No, sir. Right now, the council minutes are under approval of the NAMS council members. Once they approve it, then
Yeah.
it will be taken as
Yeah.
approved.
So that we have already taken a decision, and that will be that we had just 12th February we had the meeting, and we had the council has approved to increase the CME amount, but that is not yet what we should say effective. But once it is
Yes.
done through, once the minutes are approved but it will take only few days. So I'm just giving you this piece of information. Then we have again started a new initiative about recognizing the academic excellence in the field of various fields. You know, we circulated it this year, and this time some people are this year again the council has approved it. Again, we need, as he told, the minutes are yet to be approved. So, but this is all been decided. And then obviously we have got some that I'll tell you subsequently, some of the newer initiatives we are taking up, specifically some of the things we are taking up, like regional CMEs. We are planning 5 or 6 regional CMEs, disseminated CMEs for our task force. Our main focus will be AI in health, and secondly it will be the transplant network in the country. So we'll be doing it very soon in 5 or 6, the regions of the country. Then these are some of the things during the course of discussion. We'll also take up other issues. So now I like to comment on the suggestions from NAMS state conveners. So we have got the various state conveners. We have the only issue about the how active they are. I'll just like to request all the state conveners to tell briefly. We have received the report from few only, not the others have not replied. And some of them are not at all active. So even in the council, we have decided that those who are not active or they are not doing any activity, maybe we'll be requesting them to relinquish their charge, and we'll be putting on other people if they are busy or whatever may be the reason. So then we'll be trying to replace them. And then some states are doing very actively, but some states unfortunately are not that active. So we'll just listen from them very shortly. Yes, so we can just listen the list. Who will start first? Professor Rajendra Prasad.
Thank you. Thank you, Dr. Behra, for asking me first. Because I am a convener of state of Uttar Pradesh, as you all know. And currently I am situated in Eras Lucknow Medical College, where office of convener is there. And as a convener, we have rather inaugurated it in last months of 23, where Dr. Behra, yourself and Dr. Sareen, most of the people have participated. Then we have made our first annual convention last year, and in month of December, where the deputy CM of this state was the chief guest. So he inaugurated that convention, and many of you have attended either offline or online. And then we have tried to open the medical college in NAMS cell in the state of Uttar Pradesh in different medical colleges. And I am happy to inform that we have already opened cell in more than 25 medical college in the state of Uttar Pradesh, where I myself went personally and inaugurated that cell. And during the inauguration, the introduction about the National Academy of Medical Sciences, about 15-20 minutes lecture slides provided by the National Academy are taken, and some CMEs are also arranged during those inauguration. And reports I have already, whenever I inaugurate, I send these reports to National Academy headquarters, and many of the has been published in your say whatever you publish a newsletter from National Academy. And we have requested another maybe about 15 to 20 medical college more. Some of them have sent their names of nodal officer, and some of them are still in process of sending the names of nodal officer. I interact with them very frequently, and I think in the state of Uttar Pradesh, by the end of 26, I believe around 50 medical colleges will have an MSL and will have an active NMSL. And the second issue was that if I talk as a convener, because states, I have already submitted to National Academy, and I think committee has already been formed that how the state chapter should run, how the finances can be arranged. Because I am happy that since I'm in ERA Lucknow Medical College and under the ERA University itself, and they are, I think, very helpful, and I must thank them that every function what I did in UP in Lucknow was supported by ERA Medical College without taking any money from any other place. So, but then every medical college cannot be like this, I believe. So I think there must be some provision how the state chapter should run, because it was made new in 23.
So, sir, if I may intervene here, as you know, you are also a council member. So you have given the various suggested rules and regulations. The NAMS is examining that. We have formed a committee. So they are going through that, because we thought that was a good initiative and it should be uniform throughout the country. So we are going through, and very shortly we will be, after the approval of the EC, we will be giving those guidelines to all the states. So that is a very welcome step, sir. And at least you have given the broad outline, and it is almost, but that we need to be approved by the EC. So we are doing it very soon. Our committee is meeting, and after that will be approving, maybe by within a month or two. During our next meeting, we'll be getting those things through.
So thank you, sir. Thank you for that.
But as you have already given a report, and I think it is a very comprehensive, and you are doing a lot of work in UP. We know that you inform us regularly, and we will be requesting you will continue those activities. maybe you try to, only thing I'll tell, if you can, encourage more and more members, and they are already there because we have got a lot of fellows from your state. So please continue that and help us. In any case, you are also a EC member. And then maybe I think all the members, I like to inform you that that I should have done at the beginning. Professor Rajendra Prasad was awarded the Padma Shri by Government of India this year. So, sir, from this forum, we congratulate you, and I'm sure everybody will be congratulating you. They will all agree with me. So, continue
you.
the good work, sir.
Thank you, Dr. Behra. Thank you for your comments.
So, Dr. Aladi Mohan, can you just give, Dr. Aladi Mohan is here?
Yes, sir. Sir, good morning, sir.
Good morning.
Sir,
Good afternoon. Good afternoon.
Yes, sir. A brief update regarding, sir, when the AP state got divided into AP and Telangana, in the residual AP where we are situated, there are hardly any fellows, sir, because most of the fellows were concentrated in Hyderabad. So the first task was to encourage people.
Somebody is talking, please. Please
Yes,
mute yourself, others. Yes,
sir,
please.
as most of the fellows in the combined state were from Hyderabad city, there were hardly any fellows in Andhra, sir. The first step was to encourage people whoever are eligible to apply for both membership as well as fellowship, sir. That we have taken up. And the two conferences from Visakhapatnam, they have applied, and NAMS was kind enough to grant the conference conducting this thing also, sir. And now, post-COVID, the number of the fellows this year, actually more people are applying, sir. What we have to first do is to create awareness about NAMS and to increase the eligible fellows. A lot of people who have done published good work, etc. are there, sir. We are now, the submission process is in your leadership, it is simplified online, etc. So we wish to take forward this in a bigger way, sir.
So thank you. Only I think he can look after both the states, Andhra, Telangana.
Take it to the conference.
Okay. So in any case, so what we will request you, if you will take that, of course, the council has to approve it. So we'll be requesting you to look after both the states.
Yes, sir. From
Andhra and
Bhaskaran sir
Telangana.
time, from CS Bhaskaran sir time, I have been doing the basic legwork behind the screen for NAMS, sir. I know most people in Hyderabad also. We will take this forward in a bigger way, sir.
So if you can suggest, you are suggesting his name?
No, sir. Professor Bhaskaran, he was earlier past president of NAMS. He was from Hyderabad.
Acha,
He is senior person, sir. He was vice chancellor NTR University and all. Yes, from sir time, I have been associated with this work, sir. He only groomed me in the paperwork and other things.
Okay.
I will do my best possible, sir.
The only thing we need the fellows and the members.
Yes, sir.
From
We have conducted a drive for all the eligible, making them aware about submission process and guiding them, sir. This year, more numbers have submitted the application. We will push this forward. The state division was a handicap, sir.
Okay, thank you. Then Dr. Farooq sir, from Assam and northeastern states. So will you like to say something? Is there? No, he's not there. But he has promised he will be attending the meeting. Then from Bihar, Dr. Alok Chandra Agarwal, are you there, sir?
I'm here, sir.
Yes, sir. Please, if you can tell something briefly.
Sir, from the state of Bihar and Chhattisgarh. I am from both the states.
Yeah, Bihar and Chhattisgarh, yes.
And I am from AIMS Raipur as the professor HOD orthopedics.
Phone band karo. This is re-echoing.
Yes, sir. Please go ahead.
Okay. So
maybe he has got two things on. आप एक को बंद कर दीजिए डॉक्टर साहब.
कोशिश कर रहा हूँ सर, कहीं ऐसा ना कि बाहर ना हो जाऊं।
हैं? कोई एक को आप म्यूट कर दीजिए, आपका 2 खुला है।
वो 2 स्टेट है ना, इसलिए 2 खुला है।
चलिए ट्राई करिए दोबारा। या तब तक हम नेक्स्ट पे
I have
देखते
come
हैं।
back.
या प्लीज।
So 1 year earlier we had a meeting done at AIIMS Patna, and we had planned a symposium also. At Raipur we had done 3 meetings. Now this year we gave nomination for 2 people and a lot of nominations for DNB people. And now for the coming year we have planned 1 meeting at AIIMS Raipur, and 1 we have already sent a proposal. That is how it is. We are only 2 FAMS in Chhattisgarh, but then DNB people and MNS people are quite a lot, around 50. So a cell has to be made, but a cell is not there. At Ambikapur Medical College, a cell was formed last year.
Right, Dr. Saab, what we expect from both the states, more at least members and a application for fellows. So if you can help us doing that, and also some of the CME activities, if that can be encouraged from some of the medical colleges or the institutions.
The 2 we have planned in Chhattisgarh. I'll request Bihar also to do at least 2 this year. That is a promise. We will do it.
Then about encouraging people to apply for membership, fellowship, associate fellowship, that will be
Okay,
also
sir.
will request you for that.
Yes, sir. Fine, sir.
So then Sonu, you are there, Dr. Sonu Goel
Yes, sir.
from Chandigarh. So you can speak for Chandigarh, Punjab and Himachal Pradesh. You are the convener for the 3 states.
Right, sir.
Just briefly, we have received your report. So you have a very good plan. Maybe I know that you took over only few months back, very shortly, a very short time. So you did not have enough time to initiate any activity maybe, but you have a very good plan you have given for the next year. So we are sure you are going to do that. And maybe your... Yes, please. Can you
Right,
just
sir.
briefly tell us within 2-3 minutes?
Yes, sir. Sir, I'll be very brief. So thank you very much, sir, for giving this opportunity. And I was given the charge for this convener of Punjab, Himachal, and Chandigarh on 16th September. And what I did is we made 3 committees of 3 states so that they can work in their states, and we had a every cells in the particular states have around 8 to 10 members, and we had a joint meeting with them twice. And individually, these cells have their own meetings and prepared a plan for the next year. And the plan which they have made for the next year, we have submitted that plan in the report, which you have narrated, sir. Besides this, sir, we have 2 big collaborative meeting with NAMS. One in AIIMS Bilaspur. So that was a collaborative between that 1 day CME in AIIMS Bilaspur and one in AIIMS Bhatinda. So 2 in this 5 months, 2 CMEs has been done in collaboration with NAMS. And besides that, sir, PGI has collaborated with 2 events at NAMS Auditorium in this 5 months. So that was another thing. And in the annals of NAMS, we have submitted 2 articles, and these 2 articles have been published in annals of NAMS as well. And besides that, sir, in this 5 months, I think there were the Navigate CME has been widely circulated among these members, and these all these 30 odd members which have been there in 3 states, they have been circulating this in their medical colleges, in their networks. And besides it, sir, NAM cell has been recently opened just 10 days back. NAM cell has been opened, has been given the permission to be opened in PGI Chandigarh as well, sir. So this was the brief updates of the work done in 5 months. Thank you.
So thank you. So you have opened a cell at PGI, NAM cell. So,
So just got the
yes.
permission, but we will be having a CME come so that it will be formally opened and your presence along with the director's presence. So I think we'll do it formally, sir.
Good. Then what about the members and membership and fellowship applications from Himachal and Punjab? Because we don't have got many applications. So that is how you should help us out. How are you going to encourage? You have got any plan or anything? Or
Yes, sir. Sir, we have already done a detailed meetings on them, and hopefully in the next year you will find more such applications from these states, because I have been observer in this during that time for 3 or 4 CMEs which has been conducted in collaboration with NAMS. So I had widely disseminated those things, and sir, you will definitely find from all these 3 states a good number of applications in next year.
so I think you are also having this disseminated workshop. That is what I think the NAMS office has requested you for
Yes, sir.
for your region. So please try to include as many medical college representation apart from Chandigarh, and also we will be requesting to include some more states for this workshop, so that you invite them either to join online, or that is what we are trying to do, so that these 5-6 workshops will cover almost the entire country, so that every state medical colleges should represent. That will be one idea. I am just telling you here, because we will also writing letter. Maybe some states will be allotted to you, so that you contact those medical colleges to participate.
Yes, sir. I have got the letter, sir, and I have already made a brief plan. I have received the letter day before a few days back, and I have prepared a brief plan, and I'll be sharing that plan shortly with the detailed list of medical college what we intend to invite, sir.
Thank you, Sonu.
Thank you very much, sir.
Professor Deepak, is he there? Then Professor Nair, sir. Dr. Nair, sir, Dr. Belu Nair.
Yes, good afternoon, everybody. This is Jal Nair. Can you hear me?
Yes, sir, you are very clear.
Yes. So I just have to say that, we have done actually in the year 25, we have had about, 15 academic activities. And out of that, the important part is I've been largely involved also with the armed forces. So we have promoted a large number of applications, actually, including Gujarat had no fellows besides me. All the other fellows were 90 plus, or actually they had passed on. They were not even alive when we updated our Gujarat list. So my problem was Kapil was very helpful, because we had to get sponsorships, because I, as a EC member and as a president-elect, cannot sponsor them. But you have made that little easier by online, and Dr. Kapil has been very facilitating at the end of NAM's office secretariat. So we've had many applications reaching there directly after I go through it. I vet it. I've been forwarding it, because I don't have people to even sponsor it here. But that is happening, and we have we have to get many more. But we have already got, which was nil about 2 years ago. It was nil. But it's come to, I think, a reasonably healthy figure, including armed forces was hardly participating. So we got large number from armed forces, and we've held CMEs right from FMC to other places. And in Gujarat, we've had it in Bhuj, we've had it in Ahmedabad, and now we are having in Bhavnagar. These are all outlying areas where the government medical colleges have been involved. BJMC is the biggest college in Ahmedabad itself, where they've got private colleges also. But I've had a little problem with the private colleges because of opening the cell. BJMC has agreed. So I told them that we have officially written to you as president have written to all the health secretaries and the secretaries of the states. So my request is that every year we must renew that letter, so that it is ongoing. Otherwise it gets filed and forgotten. So that's one thing which I would request, that just renew that letter of request that we must have this and we must encourage NAM's activities and how we would actually encourage them. The letter is very comprehensive. I think we can just update it and send it. And the third thing is dissemination of the task force reports. So my venous thromboembolism was the first task force to be submitted in the presidentship of Professor Sareen that time. And we published the article in Annals. We were the first to publish it also. And now we've had dissemination activities in already 3 places, but we want to hold it in more places. We had it in, not only in Gujarat, but we had it in AIMS Jammu. We had it also in FMC in Pune. So I have been involved in a pan-India reach for the armed forces. So the next point I want to say is armed forces is treated like a state for all purposes. Whether it's Ranji Trophy matches or it is other participations, armed forces is treated like a state. So obviously, automatically by default, I've taken on this load to promote people joining as members, fellows, and also participate in various academic activities. And we published the High Altitude Task Force report also has been published. We had all the DGs being involved. So I want to sort of formalize this, that the armed forces must be formally included in this. And I would happily represent them till, I'm in the chair. But they need obviously some window of contact. Otherwise, it's so spread out. People sitting in Arunachal or people sitting in Andamans don't even have any idea. But they are accomplished people. So I just want to formalize that armed forces be recognized as a body and have a representation like we have state conveners. I would happily I'm already doing that. So that's one thing I want to do, formalize. The next point I wanted to say was, I just had a few points to tell. That is, in our act, we must have an audit on the number of participants for ongoing NAMS activities. One is do 10, but in 10, if I only have 10 participants, that's of no point. So we must have an audit to show, yes, and what action to take where there's a shortfall. So in other words, what I'm suggesting is we must have a record of the footfall in our activities, and that is very easy. Today, even in the other physical to asan ho hi jata hai, but when we have people joining us on link, we know in the platform how many people are there. So, but I want this to be sort of recorded so that we can take action where we are falling short. I've already told about the letter, if you can just send it again. And the other point which I did mention earlier also when we had a meeting was that now it's about time we must take it back to the council to see, okay, what fresh task forces which are state-centric. There'll be some state-centric problems of health which are peculiar to a state. And that actually we must ask the state conveners to think about and bring it to us, whether it's Northeast, whether it is, the East, South, North, West, we must look at special problems. And we know in the armed forces, in our different states, there are different problems. So the state, we'll be very happy to hear from the state conveners on state-centric problems. I have approached the BJMC, MP Shah Medical College in both in Ahmedabad, Games Medical College, Bhuj, which is Adani's main medical college, and then the medical college in Bhavnagar and in Rajkot. And we are having a CME in April in Bhavnagar with involvement of all the people around it. The sensitization to NAMS was dismal and very, very poor. So wherever we are having any conference, we have last few minutes, we speak on NAMS so that people know that and how to apply, what we are about, what are our activities. So that's one thing we've been doing actively, and that's made a difference. Many more people are applying, they're contacting us. So we are opening a cell now. They have given formal this thing, but in writing I have to receive it, of BJMC and MP Shah in Ahmedabad, and I'm hopeful to get in Bhavnagar because there April is the CME in, I think Dr. Kapil is already aware of it. In April, we are having a CME in Bhavnagar. So they will also open a cell. So that is in short what we have done in this area and also the armed forces. Thank you.
Thank you very much, sir, for bringing about the...
And Dr. Velu Nair, may I come for a moment?
Please, please.
Yes.
As I requested in last meeting also to Velu Nair, I have requested the AFMC Lucknow, which is
No,
a
Command
big
Hospital, Lucknow.
hospital,
Command Hospital. Command Hospital, Lucknow.
Command Hospital. Sorry,
I
Command
told them.
Hospital.
I told them.
There
I told
are
them.
very good people. They have, I think, written me, agreed also to open the cell, but there was some hitch
So
from
I will
the
tell you. Let me brief you.
rule.
Let me brief you on that. You did speak to me.
Please make
I will.
sure that if I can open there and I can go there and involve them, if it is possible. I don't know.
Let me update you on this.
Yes,
so
sir.
I spoke to the DG FMS. This in our command hospital, we have actually 7 command hospitals. All of them are 1,000 bedded plus. Air Force, Navy have 1 each, and 5 are there in the armed forces. Flagship is in Delhi and in Pune. Now, wherever you have to open a cell, for security reasons, the Ministry of Defense and the Government of India have put an embargo that you will get this cleared by the Office of DGFMS and their legal cell. That what are the activities we want to do, all that will be projected by the hospital to the Office of DGFMS. So whatever you say, they cannot take a decision. The decision is top down. So once we formalize armed forces as a participant, the DGFMS will give permission to all the command hospitals that in your particular states, Calcutta, West Bengal, Lucknow, Central UP state, all these people will be given permission to open their cells under the state convener of the particular state. So this will only happen once we formalize NAMS. We are already involved in the armed forces in a big way with the NAMS activities. And I want to take this forward. Once we formalize this, I will be bringing this in the council also. And then this will be much easier because I am aware of what you have requested them. But till it comes down from there, we will not be able to legalize this. So you may have to bear with us for maybe a couple of months more.
Thank you, sir. Thank you, sir. Please
So
get it
sir, it is a good idea. It is a
Yeah.
good idea. I think the armed forces will take it as a entity, separate entity, and in any
Yes.
case you are looking after that, so that
Yes.
formally
Yes.
will get it approval from the C. You have
Yes.
to inform them, but otherwise you do that, and once you take over as the president, you can depute somebody else to look after that.
Sure, sir. Sure, sir. Thank you.
So,
Thank you,
so
sir.
till that time, you please look after that. This is a very good idea.
My pleasure, sir. Thank you.
Thank you. So, Sonu, we have already. Dhruv, you are there, Dr. Dhruv? Dr. Dhruv? Sonu, we have already spoken. Professor Ghani from Schemes. Are you there, sir? Professor Muhammad Ashraf Ghani?
Sir, namaste. Good evening, afternoon, everybody. Sir, as you are aware that at Skims, Srinagar, we already inaugurated the NAM cell long back. We also got nominations from the nodal officers from various medical colleges. But I do understand there is a little representation from our Ladakh region because there is no medical college. Now a medical college is coming up. There are just district hospital there. In Ladakh, UT of Ladakh, we have a less representation. There is one fellow, senior fellow, who is actually now basically aged. And there is one fellow who is in AIMS New Delhi. Madam is not in the Ladakh itself. So there we have to put little more effort in increasing the memberships and fellowships. In Jammu and Kashmir, we have almost 30 members and we have now 8 fellows. This year, 3 fellow applications have come and 2 have been successful. And associate fellows, I was requesting Dr. Umesh sir, last time we had said that for J&K, there may be little relaxation or maybe some wavering of fee because these DMMCH scholars who are with us, they feel that the application process is little cumbersome and they are also not able to pay. However, at Sikkim myself, I told that for faculty, I will give exemption.
बनाना हमारे सामने
That was taken a decision that for the faculty, we will be paying their fee. But the application, they feel their application, we are motivating many of them to apply now. Regarding the activities, sir, we have done many workshops. We have done one of the aims. The AI summit was there. You were the chief guest, your good self here. And before that, we did one NAMS conference, 16 September 2024. And we also did one antimicrobial stewardship program under NAMS banner. Then we are also doing some semis.
PGS program, Dr. Mishpur was last year.
Yeah, yes, you had so activities going on at the schemes. So, sir, we want to increase those activities a little more, and we expect you to encourage your faculty to apply for fellowship. And regarding the fees which you raised, that because that seems a little difficult, but in any case, we will put it to the executive council. Let us see what. Personally speaking, I will not be in favor of that. Maybe we have got 3-4 other members. We have got the President-elect, Dr. Belu Nayar, Dr. Ashok Gupta is here, Dr. Rajendra Prasad is here. Maybe I don't know what will be their views in the, but personally I will not be inclined for that reducing the, I am sure the residents or the DM MCA students, those who are otherwise eligible for associate fellowship, they can afford that. But anyway, since sir, you have told that, I will take it to the EC. But let us see what the EC is telling, what they are advising us.
Special drive is required, so I thought one of the components drive I will take forward, but this was one of the incentives. Second is there are some people have applied for CMEs, some grants, whatever seed money you are giving, that has to be expedited.
Yeah, that will be, that is actually the secretary is very generous. So it is the application is processed without any delay, and then by and large our rejection rate is also very less, very low, unless there are some technical issues. So, and again, as I informed, the amount has been increased, and that will be implemented very soon. So we will also encourage you to participate. So thank you very much, sir.
No thing I want, Dr. Mudasir is compiling this time the list of faculties. Last time I had requested you also and Dr. Kapil sir that skimmers would like to also contribute in terms of faculty for the Navigate program. We're already subscribing, the students are there, but we would like to contribute in the Navigate also. The way PGI has chipped in, we can also chip in.
No, sure, I think if your faculty and a topic you can write to Dr. Kapil, we will try, definitely will include your
aims, PGI, schemes, Navigate program.
So chalo, we'll see that, sir. That part again, that has to go to the executive council. We'll see that. Yes, we have received your request and we'll definitely consider it sympathetically.
Thank you, sir. Thank you very much.
Then Dr. Pandey from Ranchi, Dr. Sureshwar Pandey is not there. Then from Karnataka, Dr. Kurupad, Dr. Biswanath Kurupad is not here. Then Dr. Mohan Kumar from Kerala. Are you there, sir? Madhya Pradesh, Dr. Gaya Prasad Pal. Yes, Professor Gupta, sir. Professor A.K. Gupta, sir. Yeah, Professor Ashok Kumar Gupta, sir. He's there. I saw him there.
Is it
you are there, sir? Yeah, please. If you say a few words, sir.
Yeah. Good afternoon, everyone. It's indeed a pleasure to be part of the Council of the NAMS and interacting with all the deans and directors. It's very encouraging to see the activities and interest in the NAMs. One of the very important things is a CME, which I think all of us must stress upon developing a quality of high quality of CME. And as we have discussed in the last expo, we have increased the fund allocation also from 1.75 to 2.5, which will be implemented soon. And this also brings back the burden on the NAMs to encourage more and more CMEs in different parts of the country under different state leadership. In Maharashtra, I was personally observer for 3, and we had done about 5 or 6 CMEs in different part of the state. And this year also, I have encouraged 2 or 3 more CMEs. I think what we discussed also, holding CME is one thing, and building up a virtual library of all the CME proceedings is very, very important and vital. And if all the state units and medical colleges can contribute their recording and the proceedings of the CME, we'll be very happy to have a virtual library of CME proceedings in NAMs, and which could be useful later on for various CMEs which anybody wants to conduct in their institution. I think this is very, very vital, and we are happy that we are making a progressive approach toward this. And under the leadership of Professor Behra and Dr. Velu Nair, we are indeed privileged to have very forward-looking prospect for increasing the membership. Although it is difficult, being a committee, subcommittee chairman last year, we had a tough time to shortlist people out of 360 nominations. But this year we want to be fair, and we hope that we are able to get more and more fellows and more associate fellows. It is a very good move from the Sikkim, from the Kashmir, J&K, to sponsor the faculty fee for associate fellow. I think is very, very important thing. And if it can be replicated in other institutions, it will encourage young people to join as associate fellow. With this, we want to do more and more activities, academic activities, and particularly more stress on the CME quality. Thank you, sir. Thank you.
So thank you very much, sir. Regarding the virtual library, as you, I think we have already taken a decision in the last executive council. There will be a virtual library will be created for the CME, all the CMEs that is being done, and then some of the PG lectures that is going on. And also we have requesting these regional workshops, the dissemination workshop. We will also be telling them this, whatever their material, they should supplement. And in fact, one of our consultants who is having a library background, so we have also asked him to prepare a proposal, and he should help us in establishing this virtual library. So that he is already, I think, working on it.
Yes.
So we'll be definitely doing that, sir. That is a very good suggestion you had given during the last EC meeting. So we'll be doing that, sir. Definitely we'll be doing it.
Thank you, sir. Thank you.
Then Dr. Sureshwar Mahanti from Odisha. Dr. Mahanti, are you there, sir? Sonu has already spoken.
Sir, I have one brief suggestion for the NAMS journal, sir. Because, sir, actually these days, medical college faculty under NMC, they will send the publication to a journal which is indexed in 4 sources, sir. First is DOAJ, second is Embase, 3 is Scopus, 4 is PubMed Medline. So the indexing information in the website is not displayed, sir. Many faculty were asking me, because our journal is user friendly and they give good suggestions, reviewers are good. When we encourage submissions, they were telling, sir, is it NMC indexed, so that they get an opportunity for their promotion, sir. The indexing information may be displayed, and DOAJ for a regularly published journal is easy to get, sir. We can actually double or triple our submissions if this is done, sir. It may be considered, sir.
Sure. Yes, please note it. Yes, Kharbanda sir. Yes,
sir, thank you,
welcome,
sir.
Sorry,
Thank
I
you, sir.
missed you.
No issue, sir. I was very carefully listening to all the deliberations. I just wish to say that we call it a digital library, not just virtual. And that is one point. The second point is what Dr. Gupta has suggested is wonderful. But in addition to that, if you ask them to share PDF files of the presentations, like what we are doing now for our oral health series lecture, we are asking them to give us, after the presentation, share us with the PDF file of your presentation. And that can be shared and available online. You know, that becomes also sometimes you don't need a big space in the video, but with a small space, cyberspace, you can use the PDF files. That was the only additional submission in addition to what Dr. Gupta said.
Yes, noted, sir. Thank you. That is
Sir, the only problem could arise a copyright of some of these patient data if you are sharing the. But anyway, that's something which we can sort it out later on.
Yes, so Dr. Thapa is not there.
We can.
So Dr. Kuldeep from Jodhpur, Rajasthan. Dr. Kuldeep Singh.
Good afternoon, sir. Thank you for the opportunity. I would like to congratulate the National Academy of Medical Science for doing such a wonderful activities and CMEs, and also enhancing the the conference budget also, CME budget also. From AIMS Jodhpur was involved since beginning in 2013. We conducted a NAMSCon 2013, and we are also part of the NAMS Center for Research in Medical Education. So that was a good thing, and that is still continuing, although despite there is no support, but our AIMS Jodhpur is supporting that. We conducted the 2024 NAMSCon also at AIMS Jodhpur. In Rajasthan, actually, sir, we have more than 30 fellows and around 100 members, and we are still encouraging the people to join, and we are also proposing the CMEs. And recently, we got a CME proposal from NIMS Jaipur. Our team at Jaipur is very active, and Dr. Shiv Gautam sir, Dr. M.R. Jain, and Dr. Malti Gupta, they are very actively and they are promoting all the activities of the NAMS, like AI course for the medical professionals. They are just putting it forward to all the PG students and the faculty also. So we are doing a lot of things. Although last year there was some sluggishness on our part, but we'll definitely pick it up with the support of the NAMS and also our members, fellows from the Rajasthan. We have basically 4 Jaipur, Ajmer, Udaipur, and Jodhpur. Recently, we have the more members from the AIMS Jodhpur also joining as a post associate fellows also. So, and regarding the journals, sir, the question they were asking about the DOAJ, it is DOAJ indexed. Our Annals of National Academy of Medical Sciences indexed. Being the associate editor, we are now having a more articles submission.
No, sir. My point was not that it was not indexed. It is not displayed in the website properly.
Okay.
When we held a workshop for medical college faculty, that NAMS journal is an encouraging journal. Please submit. They were asking, sir, when we submit our published article or whatever it is, our state government DME will ask indexing proof.
Yes,
Website mein dig nahi rahe, sir.
Okay. That will ensure.
Exactly. For that only, sir.
Okay, sir. So this is all.
Dr. Aladi will take care of that. We'll be asking Dr. Jain to look into that.
All from AIMS Jodhpur, sir. Yes, sir. Sir, want to say something, Dr. Shiv Gautam, sir?
Yes, please, sir.
Since Dr. Kuldeep has talked about Rajasthan, I thought let me also share a little bit work which we have done in Jaipur. Sir, we have started an awareness program about the names in Jaipur. And we have done in all the medical colleges of Jaipur, including private medical colleges, 4 internship sensitization programs in geriatric mental health. What we do is that we go to the medical college, request the principal and the administration, and all the outgoing interns of the medical college. We give them a one-day program wherein we have about 45 people, fellows and members in Jaipur itself. So we select out of them, and our faculty goes there to every medical college, and we conduct a sensitization program wherein they are made aware about the activities of the NEMS, what is NEMS, and how young people can join NEMS, and then different aspects of the geriatric health, cardiovascular, mental health, gynae health, dental health. About 8 lectures we have on different parts of the geriatric health. And this capsule on geriatric health is working very well as intern sensitization program. Second program, which is an annual program, which we are conducting for last 4 years, is a geriatric health program for the elite population of the city of Jaipur. And we call the retired professors from the university, from the other places, doctors, and we give them how they can look after themselves, basically on geriatric health awareness. And this program is also catching very well in the city of Jaipur. Then we are encouraging the faculty members of the medical colleges, wherever we conduct such programs, to join the National Academy of Medical Sciences and apply for membership and fellowship. Then this year we have taken a very ambitious program, that is empowering youth. So what we are going to do is to do empowerment of youth in the medical colleges, students and residents, to personally equip them in various aspects of medical leadership and also emotional health. So such kind of programs we are conducting at Jaipur in a way. And I'm happy that Dr. Kuldeep has already mentioned about it in his report. So I thought, let me add this to his report right now, rather than speaking when you invite the emeritus professors to talk. Thank you very much.
Thank you, sir. Really very encouraging things, good initiatives. Thank you. I think others also should, the other conveners also can think in those lines. Now we go to Tamil Nadu, Dr. Swaminathan. Dr. Swaminathan, are you there? No, you are not there. Then Dr. Reddy from Telangana. Professor Rajendra Prasad has already spoken. Yes, Dr. Minu. Dr. Minu Singh from Uttarakhand. I saw her, she was there in the... No, she has left. Okay, then Dr. Durgapad Bakshi from West Bengal. I think we have completed the... Any other... Dr. Farooq sir, you have joined back. Yes, Dr. Farooq sir. You just unmute yourself. Yeah, please. Dr. Farooq. अच्छा हाँ तो in the meantime I think we'll go to the, by the time he is connected, we'll be discussing about our emeritus professors. Actually, welcome all of you again. You know, as you know, you are all the elite class of fellows, I should say that way. So you are the emeritus professors. So now actually what we'll just like to discuss and get your views how, in fact, the whole idea of this emeritus professorship is to utilize your knowledge and wisdom for propagating medical education and the research, teaching, etc. So how are you doing, and what work you have done, and if you find any difficulties, or if you want the NAMS to do anything more. Ideally, it is the you people are the the distributors of knowledge, should be helping the medical colleges and institutions to upgrade their departments and all that. So I do not know how much you are being used, your talent, how much it is being utilized, or you want anything more from our side to be done, because we had got high hopes on you. So what you people are doing, or where is there any lacuna in that? Obviously, soon after this meeting, we are meeting all the institutions and medical colleges of the country. They will be joined, and we will be again informing them about the availability of you people for them, to help them out academically. So that will inform them definitely. So anything from your side. So please.
Sir, can I speak? Can I speak, sir?
I had a discussion with Dr. Nilima. If she is around here, she can share her thought on the Professor Emeritus.
Professor Nilima Kaisagar.
Yes,
Madam.
Yes, thank you. Thank you very much for
good
this
afternoon, Madam.
opportunity.
Welcome.
Good
Please.
afternoon, sir. Good afternoon. It's indeed a great privilege and a pleasure to be with all the members of the EC, as well as all the conveners of the state. And thank you very much, Dr. Ashok Gupta. One of the things that I would like to mention here is that through the ICMR, we had initiated a prescribing skills course, which was an online program, and we had faculty and colleges from all over India participate in that. And this was an online program run through the Government of India's Swayam platform, and supported by IITs of Mumbai and Chennai. And we had run it for 3 years. We had over 17,000 participants, from interns as well as from the private practitioners. So since the NAMS is now mandated to be the torchbearer for the CME program, I would suggest that this is a very good opportunity for all the NAMS emeritus professors and conveners to contribute, so that we can take up this thing forward. And I will be happy to meet the AC members and give details of what has been done before, so that based on that platform we can take it forward. And I think this is something which would go a long way in being able to provide more or less free of cost. So NAMS can charge.
Can't hear you.
Free of cost. Can provide. Can you hear me now?
Yes, now we can hear.
Yeah. Were you able to hear before?
In between, we lost you. Otherwise, it was...
Okay. So in short, this is the prescribing skills course with 50 modules, which has been developed by medical colleges all over India. And through NAMS has such a galaxy of experts now. With their help, I think we can take this kind of a program forward. And I'll be happy to share along with Dr. Ashok Gupta, Bera sir, and Professor Velu Nair, and we can see how we can take it, so that it is an activity which can be made available, intended for interns and private practitioners, which should, I think, greatly help. Thank you. And of course, we have been through Ashok Gupta working on to the annual program, which is to be held in Chennai. So I'll stop here so that other members can also give their viewpoint. Thank you very much, sir.
Thank you, madam. Thank you for the suggestion. We noted that down.
This is Dr. Ganapati. Can I say a few words, please?
Yes, sir. Please, sir.
Okay. Just please don't take it as a criticism or anything. It is just the real world experience I want to share with you. Most of us are 75 plus. Now, it is very embarrassing for the designate to go and request a head of an institution to invite him, number one. Number two, most of our students even have retired. I think it's a National Academy of Medical Sciences should take the initiative. And may I suggest, out of the 52 professors now, I think you need to find out, as on February 2026, how many are really willing to travel to spend a few days, number one. Number two, the website unfortunately gives only my name, my telephone number, and my email. The profile is not there. Now, in practice, unless there is a personal contact of the head of the institution with the potential invitee, nobody is going to take the bother. So first thing I would request you is to please update the website. I would suggest you get 10, 12, 15 topics which the emeritus professor is absolutely confident about in talking and where he is known nationally on that particular subject. I'll give you a simple example. 3 months ago, I spent 7 full days at AIIMS Jammu. Now, I had written to NAMS before, but for some reason or the other, there was no response. It was through a personal contact. Luckily, the president of the governing council of AIIMS Jammu is about 10, 12 years junior to me. And so he was very interested. And so I spent 7 days. I also spent 5 days at AIIMS Rishikesh, where Dr. Meenu Singh was kind enough. And of course, I know her for the last 25 years. So it's entirely through personal contact that this happens. Now, sending a letter is the first step. I totally agree with it. But as somebody had earlier remarked, it will be filed. So my humble suggestion is, if the members of the executive committee or somebody, you please go through 10, 12, 15 emeritus professors with their background credentials as of today, not their credentials 5 years ago or 10 years ago. They may have retired as Dean, Vice Chancellor, something, but we are only interested in what it is today. And then you, sir, should, the Secretariat should, if you, I'm sure among us, we know somebody, and then, unless there is a personal call, this is not going to happen. Now, having said that, I would strongly suggest this be done. The website should be updated. Telephone number and email is of no use. The present summary of your biodata, what are the topics you would like to talk on, what is it that you want to do, and then the head of the institution can decide based on your background whether you are worthwhile inviting. The initiative must come from the institution and the National Academy. It's very embarrassing for a 75-year-old to write a letter to a 45-year-old or 50-year-old dean, introduce himself, send his full CV, etc. And most of the time you don't get replies also. Thank you. I'm sorry I'm being very curt. I don't mean to be curt, but this is the real world.
So no, that is very well taken. Nothing to be, offensive or anything. That is the
Can
way.
I come in? Sir, can I come in?
Sir, yeah, please.
Just one line suggestion, sir. On the suggestions of previous speaker, that every emeritus professor who has identified his faculty, the respective professor of that medical college in the faculty should identify and send a letter from the institution rather than the emeritus professor himself writing to various students of his, and it should go from the National Academy of Medical Sciences. Thank you, sir.
Yes, madam.
Good afternoon, everybody, and thank you for having us all over here. And I've been listening to all the suggestions from the state coordinators and also from the people of repute. What I like to say is that first of all, 3 areas which NAMS has to focus upon. We started talking about leadership and all, but now one of the important areas is One Health. The second part, which we need to, AI is already, there on the agenda, but how to take it in the form of capsule to different medical colleges, that becomes important. The third part is, system strengthening, because this time the theme of WHO is also talking about, universal health coverage, and unless our systems are strengthened. So this also calls for a CME, and if willing, I'll be willing to take some of the, sessions on that. And the most important part, I'll say that Viksit Bharat 2047, because we do have to have not one strategy, but many strategies from different, disciplines to talk about that part. Now, coming to, as I was listening to, my earlier speakers and all, it was regarding, liaising with the emeritus professor with different organizations. So first of all, definitely NAMS can play important role as to in different specialities how the emeritus professors are there. So, but then, people also know, because you have been promoting fellows throughout, because like since last 3 years I have also promoted, Dr. Kapil is well aware of the fellows and all, and quite a number of them have already got the fellowship also. So we have to, those of us who are the fellows, have to talk more and more about that to our respective medical colleges, like not only of a state but across, because it's a small world. Another important thing is that even professional associations can play an important role, because our academicians are also members of different professional associations. Like yesterday we had a meeting with WHO headquarters, and it was talking about 3rd March, which happens to be World Hearing Day, and the theme was child centric, from communities to school and all that, but they had not involved Association of Pediatrics. So I told them, so that is where important is that we talk to our own associations also, like we have got Indian Association of Preventive and Social Medicine, or Epidemiology Foundation of India, or Indian Public Health Association, where we do have lot of people from the specialty who qualify for that, but they are just not aware of the fact. So that is another important thing which I like to say. And then regarding the we also have to be very, very proactive. Looking at the activities of NAMS, like Jolly Grant Medical College, they just contacted me a few days earlier about the CMA. Before that, AIIMS Bilaspur had spoken to me with the topic and all that, how to go ahead with the CMA. So that is where our expertise come in. So it has got to be NAMS plus the proactiveness of the emeritus professor. Definitely that is very, very important. And definitely as we age, that factor also of reluctance and hesitancy also comes in. So I think yesterday or today you must have, sir, got a letter, Dr. Kapil, also with regard to because World Health Day on 7th April also talks about universal health coverage, and not many of our faculty members across medical colleges are comfortable enough in talking about that issue. So I feel that apart from the emeritus professors, we must take help of eminent people from different institutions. Like when we talk of system strengthening, to my mind NHSRC comes in, kind of who are dealing with the systems and all that. So, and but then important is that, for in my case, I got the application directed towards the president and towards the secretary general. But important part is that they also should know that basically what are their areas, because now we are talking of not one thing but 12 different activities which are focusing from comprehensive primary healthcare to tertiary primary healthcare, like from mother to child to geriatric to communicable, non-communicable diseases, palliative care, and all of that. It is everything. When you talk of under the sky, it has been put in task forces of Ayushman Arogya Mandis, and that is all carried upon. So I feel that we first need to kind of look at what should be our immediate focus areas, how we can make best use of emeritus professors, both in proactiveness from, first of all, our comfort level for the medical colleges, our invitations and all that, and the second part is that the medical colleges proactiveness also, that is important. 7 days, of course, I feel unless the medical colleges feel it's too longer this thing, but 2 to 3 days definitely people will be willing to go, and that is important. Unless there is a series which one wants to cover, that is important. So thank you so much. These are my initial thoughts, and definitely we'll be promoting articles for NAMS also. This is one of our areas. Thank you so much. Thank you.
Sir, can I make a small comment over here? For National Academy of Medical Sciences is under Government of India. We are subjected to audits. There are well approved guidelines that how the emeritus professor can go and deliver lectures. First, they need an invitation from the head of the institution where they are going. Second is the head of the institution should mention that the secretarial assistance and the local logistic will be provided to the emeritus professor. Third is NAMS requires what activities they are going to perform while they make a visit over there. We cannot, NAMS cannot approve the sanctioning of their visits unless until few guidelines are being followed. It can't be that I am going there, I will deliver the lecture, please give me the honorarium. We can't do it because we are bound by the Government of India rules or the rules which have been approved by the NAMS general body. So please make sure that we cannot do anything unless until these rules, these guidelines are followed. So please help us. We would love to have all the emeritus professors to go to different institutions and strengthen the expertise of the peripheral medical colleges. But what is happening is the guidelines are not being followed, so we are handicapped by sanctioning the permission to them. Thank you very much.
Sir, with the permission of chair, can I just come in for 1 minute comment, sir?
Sure.
Yeah. So, echoing what Dr. Professor Ganpati and Sunilaji has mentioned, that we must have the detailed profile of a professor emeritus in the website so that people know what are their, and if they have a previous recorded lecture, that also can be added into the website. So those will be useful for shortlisting or invitation being sent by the head of the institution. Second thing, which Dr. Surila said, there should be proactive action on behalf of the Professor Emeritus also. I think this is a very welcome statement, and there should be more and more proactive action from the Professor Emeritus. Actually, last year annual report was very discouraging. Professor Kapil has shared a report to us. Out of 39 Professor Emeritus, only 3 lectures were taken, and that to 2 by 1 Professor Emeritus and 1 by 1 Professor Emeritus. So it's very discouraging to read the report of annual report by the council when we see out of 39 only 3 lectures were taken. So I think this is a time that more and more proactive action should come from the Professor Emeritus, and whatever Dr. Kapil has said, we have to follow the rules and regulation. But it's a welcome action, and we should utilize more and more talent of the Professor Emeritus.
Sir, out of 52 emeritus professor, only 2 are being invited. And I think so they follow the guidelines and then they get the approval. If you look at the NAMS website, we have displayed very categorically all the list of 52 emeritus professor with their subject, email ID, mobile number. We have sent letter to all the medical colleges that please invite, if you feel like you may invite any of these emeritus professor, NAMS would be happy to support their travel and the honorarium. Unfortunately, they do not get any invitation. I don't know why. Okay, except for Dr. Tejinder Singh, who is there. Like, this is what we have it at the NAMS website. You can just download their say core area, their mobile number, their email ID. The host institution has to take care of it. We have written letters to all of them to please invite the emeritus professor. Sir, we are bound by the Government of India rules and regulations, so we have a difficulty. Thank you, sir.
Sir, one thing I wanted to ask you. Sir, can I ask one thing?
Please.
Yeah, sir, it was like the invite which has been sent to me yesterday is from the head of department. Though I told them it has to come from the head of the institution, they said we can also send. It's from AIMS Rishikesh. So I tell them to send the invite again through head of the institution, or it's so, and they have mentioned all the lectures and all that. That is by Dr. Vartika, and I just wanted to know that should the letter be coming again, because for the first time one needs to be, kind of adherent to the guidelines, and then you become perfect,
We have to adhere to the guidelines as approved by the council and the general body of NAMS. We
Sir, can I
cannot
come in?
make any deviations.
Dr.
Can I come in,
Behra,
sir?
may I come in? Yes.
I am Tejinder Singh, one of the emeritus professors, and I think I have been regularly doing 4 to 5 visits per year for the last 3 years. I must tell you that NAMS secretary has been very helpful, and the moment you send them the complete list of documents along with all the invitation letters, etc., it doesn't take more than 3 to 4 days to get a approval for the visit. Recently, we did one with Dr. Prasad at Ramanohar Lohiya, Lucknow also. Sir, if you remember. I have just
Yes,
two
yes, I
points,
remember.
just 2 points to make. One, that as already pointed out, this
आया
scheme
तो नहीं तो
actually works on a personal basis.
आया
It
नहीं
still doesn't appear to have been institutionalized. So can I request the NAM Secretariat, then in addition to writing to the DRMEs, if you could send letters to the individual deans and vice chancellors also, maybe it might have a better dissemination. Thank you.
Sir, we
may
have
I
sent
come in,
letters to
Dr.
all the
Behra?
principals and the dean and the director of AIMS. We have sent them a letter through our email ID. And we'll send a reminder
Behra,
again.
may
Sir.
I come in? Dr. Behra,
Sir,
may I come
I
in?
have a different dimension to add after Dr. Rajendra Prasad. He finishes.
Yes, Dr. Prasad.
NTF वाइस चेयर 1 वाला ईमेल में भेजा सर।
अच्छा ठीक है, ठीक मैं देख लेता हूँ।
Yes, sir. Please बताइए sir.
Dr. Behra, yes, also if I tell my experience, I have already visited, as Dr. Kapil knows, the many medical colleges, following every rule, getting letter from the deans, and then arranging the program. I visited DSS Medical College, Mysore, then Pondicherry Institute of Medical Sciences as Pondicherry, and and Manankula Vinayak Medical College, and Jawaharlal Nehru Institute of Postgraduate Medical Education. No, even not. But then I have also requested many more deans and the vice chancellor to arrange, give a consent for the visit, and then we tell them whatever that at least my specialty, what I can. I have no, complaint against because whenever I put an application to the National Academy, I get the permission. So and I have no hesitation to say little more proactiveness is required from emeritus professor side, and as Kapil has said, probably frequent reminder to the deans, to the vice chancellors, that they are our emeritus professor, and although they are doing it, but more frequent reminders, so they can invite, or else when I can write a letter, they can send a reply. I have already made in last 6-7 months, maybe about 13, 14 vice chancellor oblique principals oblique directors to please allow, give consent of my visit. I hope, like BHU has just informed me today, that they have agreed and they wished my date to visit as a BHU, Institute of Medical Sciences. So what I'm trying to say that I agree that most of the emeritus professors are around 75, and but little more proactiveness from himself or herself, and then the academy probably has to little more proactive, writing these frequent letters to the deans, vice chancellors, directors, principals, to the various medical colleges also, apart from the DMEs and other issues, so that this gets met. But this is a very good program. I believe wherever I have visited, people have appreciated that, and I have sent the reports to the to Kapil also.
Thank you, sir, because we have another scheduled meeting. Will be with all the medical colleges and institutions. So very quick comments. Anybody
sir,
else?
One very quick comment, sir, from my side.
Please, sir. Yes.
Sir, in addition to our visits, we are doing also. Is it okay for me to continue?
Yes,
Am I
sir,
audible?
please.
Yeah.
Please.
So what I have been doing is that all my research publication, I'm showing my affiliation as National Academy of Medical Sciences, Emeritus Professor. And this gives a very wide coverage to the National Academy in terms of developing its credibility. Even in my books, I have shown my affiliation as Emeritus Professor, National Academy of Medical Sciences. And that is also a kind of an extra role or extra weightage which is coming. And I think all others, those who are still publishing or writing, they should show their affiliation as National Academy of Medical Sciences.
Yeah, that is a good
Yes,
suggestion.
can I
Right.
give a small suggestion here?
Please, please.
ma'am.
Yes, thank you, sir. Thank you, Dr. Kharbanda, for mentioning that, and that's really a very important point. I would also like to mention here that we get invited for various CMEs, and Dr. Rajendra Prasad was also present in one CME where we were jointly together there. And at that time, the travel funds and also the stay, etc., was all arranged by the local inviting institution. And in such case, we don't have to get back to NMS for any financial assistance. And I think that is also something which, as a and while giving the lecture, we say that as emeritus professors from NAMS. So that also we should add on to the NMS list is something I thought is a useful thing to do, because not always that we need funds from NAMS.
Yeah, I just wish to say that in all lectures, national or international, online, physical, or in other way, this affiliation should be shown, and I have been doing it.
Yes. Yeah. Yes. Thank you for that suggestion, sir. Thank you.
Professor Kaur, any comment? Professor Premises Kaur, any comment, sir?
Thank you, Dr.
Thank you, madam.
Sir, I think I must thank the National Academy for giving me this opportunity to serve the Academy in the capacity of Emeritus Professor. I have a suggestion that since you, from the board, you are aware of the different specialities existence in different medical colleges, including AIMS, PGI, SGPG, and everywhere. So it would be a good step from the National Academy themselves to draw out a program for the emeritus professors and to involve them in different areas of teaching, research, and also taking ward rounds like that for a short period. You can prepare what I would say, a program for all the people in different specialities, and which would become easy to follow, and giving sufficient time also to the concerned teacher to prepare himself, rather than we trying to contact the different medical colleges and other things, which may be difficult, or depending on the medical colleges to select the emeritus professor from the list. That's also not very feasible. So the leading role has to be taken by the National Academy.
So anyway, that is we'll take that into consideration. Let us see. Any last minute, because we have to close down, because we are already, it is 3:30. Anybody, any last minute, a quick comment?
So Dr. Behra, this is Jalal Naya here. I think we've
Yes,
had
sir.
very constructive points from various esteemed members here. We can take this back to the council for due consideration to formalize various, some of the suggestions are very good. And the practical problems on the ground, which is the real world problems, is what has been expressed, which I appreciate. And I think we should take it back to the council, address it in whatever best way we can, and then formalize it. And then circulate it back amongst our esteemed emeritus group of emeritus professors to facilitate this, to move it forward, because there have been some blocks. And those blocks is what each one is actually bringing forward. And some of the suggestions have been very practical and good. So I think we can, with that, I would say we will take it back and we'll get back to them.
Sir, in continuation to Dr. Kar, a point which is raised by him was very, very good, is a clinical ward round or clinical OPD support, bedside medicine. If that can be part of the Professor Emeritus, can be added over and above lecture, I think this will increase the utility of the Professor Emeritus. Emeritus Professor. I mean, this we can discuss at the council meeting.
Sure. So should we then, I think, because it is already time, we have to have the next meeting scheduled.
Thank you.
People are waiting. So thank you, everybody. Thank you.
Thank you. Thank you.
Thank you.
Jai Hind.
Thank you.
Thank you, sir. Thank you.
Thank you, all of you. Thank you. Bye-bye.